All right, folks, I think we're going to get started. Thank you for your patience. Welcome. Thank you for joining us today. So we continue our journey to cover the 5 steps of evidence-based practice. And today we're going to cover step 2, which is about inquiring the best evidence to answer your question. So I'm Dr Odgers-Jewell, the Director of Research at Northern New South Wales Local Health District, and I belong to one of the member organisations of the Rural Research Collaborative Learning Network. Once again, joined by Dr Zoe Michaleff, so Northern New South Wales LHD's Research Operations Manager. And we're also joined today by Dr Kate Odgers-Jewell, who is our amazing allied health conjoint academic with Bond University. And Zoe and Kate will guide us through today's session. So to officially get us started, we acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians of living culture, their connection to country and their contribution to the life of this region. We pay our respects to the ancestors and elders of the region and to all Aboriginal people, past, present and future, and any Aboriginal people that may be joining us today. So welcome. And so last week, Dr Zoe guided us through session 1, which covered what is evidence-based practice and why it's important. Zoe provided an overview of the 5 steps of evidence-based practice and also went into detail of step 1, which is ask. As a brief recap, very briefly, of that session, we learned that an evidence-based practice approach, so EBP approach, can be used to assist us to make decisions. And when using an evidence-based practice approach, we need to create the current best evidence from 3 key sources, that be your knowledge, skills, and experience, the values and preferences of the patients, and also research evidence. Today and over the next 4 weeks, we're taking a closer look of the 5 steps of evidence-based practice and how you can become more comfortable and confident navigating the research literature to make sure you can incorporate the highest quality or best research evidence in your everyday practices and also decision making. So we heard a trigger for evidence-based practices when you encounter a problem or uncertainty in the first step of EBP. EBP is being able to convert your problem or uncertainty into a well-defined and answerable question. And to assist in asking well-defined and answerable clinical question, last week, Zoe introduced us to the PICO framework, which provides a structured process for developing a well-defined, specific, and therefore answerable research question. So very briefly, PICO has 4 elements to it: the P, which stands for the population, the I, the intervention, the C, the comparator, and O, the outcome. So last week, Zoe also spoke to linking the question type to the relevant elements of PICO, remembering that not all elements of PICO are required for all questions. So as an example, questions relating to frequency or prevalence will typically only need the P, so the population, and the O, the outcome, to be defined and converted into a question. On the other hand, questions related to treatment effectiveness down here will include all 4 elements of PICO. So lastly, we looked at the best primary study design last week to answer the various types of clinical questions. Remembering there are numerous epidemiological study designs, and these match the types of questions being asked. Example, for questions around frequency or prevalence, it's accepted that the cross-sectional study is typically the best study design to answer that type of question. For questions of prognosis or risk or prognostic factors, the cohort study is the best. The cross-sectional study is better suited to, or best suited to, diagnostic test accuracy questions, and the trusty randomized controlled trial is best suited for questions around treatment effectiveness or assessing the impact of an intervention. So that's a brief recap of session 1, which we did last week. This week we're covering session 2, and we're going to work through step 2 and build on what we have learned about the best study design to answer your question, cover how and where to find the evidence, and also hear about what sources of support and library services may be available to assist. So by way of a reminder, a handy workbook has been developed, and this is a resource for you to keep, place for you to take notes. It's got group activities and also spaces for templates. Just a little bit of housekeeping. So the session is being recorded for viewing at a later date. If you don't want to appear in the recording, simply turn off your microphones or your cameras, and also keep your microphones on mute, and we've done that for you. Even though that we've muted your microphones, we still encourage people to ask questions. Please do that using the chat function, and we'll endeavour to answer them as we go along. If we do have time at the end of the session, we'll open the floor up, we'll unmute you in an attempt to answer some live questions. So without further ado, I'm going to hand over to Dr. Zoe, who's going to guide us through today's session, and then also we'll hand over to Kate. Thanks, Zoe. Awesome.
Lovely. Thanks, Alex. And just check that you can see my screen and you can hear me.
Can hear you fine, and the screens come up perfect.
Perfect. So I'm not going to be talking to myself for the next 20 minutes. So thanks everyone for making it back to round 2. Great to see you that you're joining us back on this journey. And so today we're going to have a look at Acquire. So what we're really talking about is the skills and knowledge you need to be able to find the best evidence to answer your clinical questions. And so where we're going to start. So I said last week that we're going to look at the why, because understanding the why makes it more relevant to you, and it means that you're more likely to remember, recall and implement what you're learning. And so why do we need to acquire the best evidence? And when we're talking about best evidence, we're talking about the most trustworthy, robust, believable or least biased evidence. And the reason for this is that not all evidence is created equal. And so last week we learned about the best evidence to answer the various types of clinical questions. We looked at the best primary evidence. So that's the type of evidence that you would do if you were undertaking the study or you're looking for the answers. But what you'll find out is that there's actually various, depending on your clinical question, there's actually various study designs that can be used to answer that clinical question. And so it's really like in most things in life, there's more than one way to do it. But when we're using an evidence-based approach, ideally we want to be using the best evidence available. And so I'd like to introduce you to this concept called the evidence hierarchy or the evidence pyramid. And what you can see is that there's lots of various sources of study designs. And the evidence hierarchy is a pyramid that goes from most biased information down the bottom to the least biased or the most robust types of evidence up the top. And you can also see that the evidence hierarchy is broken down into primary research that we were introduced to last week, and then higher levels of evidence called synthesized research, where multiple studies are put together. So ideally by design, those conclusions are more robust and more believable. And ideally, when we're looking for evidence, we're looking for the study designs that will answer our clinical question, but we're looking for the study designs that are as high up that evidence hierarchy as possible. So we want to be integrating the highest levels of evidence into our decision-making to then inform our decision and truly become evidence-based healthcare professionals. So we learned last week that there's different types of questions that we can ask, and the best level of evidence depends on the type of question that you're asking. So across the top row here, we've got the different types of questions that you can ask. That might be frequency or prevalence, risk, treatment effectiveness. And down the first column here, we've got the different levels of evidence. And so ideally, we want to be making decisions based on the highest level evidence or level 1 evidence. So this is the most robust, trustworthy, believable evidence or least biased evidence. And as you move down the evidence hierarchy, you've got level 4 evidence, which is the most biased evidence. And so when searching for evidence to answer our clinical questions, ideally we want to target our search to level 1 evidence. And if you cast your eye across this table, you'll see that it's a systematic review of level 2 studies. So really the systematic review is the highest level of evidence we could be using to inform our decision making. And the level 2 studies, these are the best primary study designs that we were introduced to last week. And so depending on the question that you're asking determines the best primary study design. Like I said, though, there's more than one way to find the information that you need to inform your decision making. And as there's lots of different study designs that can be used to answer your clinical question. And it's just important that you remember that as you go down the evidence hierarchy, the bias increases, and so your confidence in that result decreases. So ideally, again, we're looking for the highest levels of evidence to inform our decision making. This coming from level 1 or level 2 evidence. And just to note that I know a lot of people use, it was saying that they ask qualitative research questions in their everyday work scenarios. And you'll see that qualitative is missing, research is missing from this table. And that's not without reason. The reason being that if we're looking to change practice, most often we're asking questions of treatment effectiveness. And so what we're really looking at is to be then targeting our search for evidence around systematic reviews of randomised controlled trials or randomised controlled trials themselves. So we're looking at more the quantitative research side for this seminar series, and we will be focusing on treatment effectiveness for the remainder of the seminar series. So coming back, if you remember last week, we introduced to this clinical scenario. So we identified, you were talking to a friend about evidence-based practice, and the conversation took a strange turn when you started to talk about the effectiveness of parachutes for people who are jumping from an aeroplane. And we converted this conversation into a well-designed and answerable clinical question, including all 4 elements of the PICO framework. And the question we ended up landing on was, in adults who jump from an aircraft, is a parachute more effective than an empty backpack in reducing death and major injury? So now what I'd like you to do is have a go at thinking about, well, what type of question is this? And the poll should be popping up on your screen in a second. For you to answer. So just having a think about what type of question is this? Is it a qualitative question? So is it about capturing people's thoughts, feelings, experiences? Is it a frequency or prevalence question, looking at how common something is? Is it a diagnostic test accuracy question? So are they looking at how effective a test or assessment identifies people with or without a condition? Is it looking at predicting something, describing the course, or is it around treatment effectiveness? What type of question do you think it is? So hopefully you've been able to access the poll and the responses are coming through. The poll should be either in your chat bar or it might have just popped up on your screen. Just seeing if your responses come through. And perfect. What I'm seeing is, I'm not sure if you can see the results, but what I am seeing is that people have rightly identified this question to be a treatment effectiveness question. So well done. That was the vast majority of people. Excellent. It is a treatment effectiveness question because what we're looking at doing is introducing a parachute, one intervention, comparing it to an empty backpack. So they're intervening in some way and looking at the effectiveness compared to another treatment. And so now that we know it's a question of treatment effectiveness, the next poll that I'd like you to respond to is, what study design, sorry, I peaked too soon. There's no poll for this one, but just having a look across, what study design would you provide you with the highest level of evidence? So we know it's a treatment effectiveness question. Just thinking through, what type of study design would be the most effective, give you the best evidence? I might have a poll there running that's not appropriate. And it is a treatment effectiveness question. So ideally, we're looking for a systematic review of level 2 studies, so systematic review of randomised controlled trials. And if we're thinking that there's not enough evidence to have a systematic review of randomised controlled trials, ideally we're targeting our search for a randomised controlled trial. So now that we've got our question in a well-defined and answerable format, we know the type of study design that we're looking for. Let the search for research evidence begin. And so we begin our search really by reflecting, taking a moment to reflect on what we know. So we've got our well-defined and answerable clinical question, and we know the highest level of evidence to answer our clinical question. And now we're going to use a framework called the ABCD framework. And as healthcare professionals, I know you are very familiar with lots of ABCD frameworks, but this is another one to add to your knowledge base. And so this is the ABCD of being able to search for and find evidence that is going to answer your clinical questions. So A is for assess the topic scope and goals, B is for brainstorming keywords, C is to choose your database, and D is to document your approach. And we're going to go through this framework step by step. So the first step in, I guess, as we begin our search for the best evidence to answer a clinical question is just to take a moment to assess what it is we're actually doing, as this is going to help frame our thinking and guide where we're going to search for the evidence that we're looking for. So assess, you might start to think about things like the topic. Is the topic that you're looking to answer, is it part of mainstream medicine or is it discipline specific? Is it around a common condition or a common treatment approach, or is it really more focused on a new treatment approach or something like a rare condition? Is the scope of your project broad? Are you looking to find out how common a condition is, how to assess it and how to treatment, or is it really quite narrow in the fact that are you looking to find out the effectiveness of a particular treatment compared to another treatment? And what's the goal or purpose of your foray or delving into the literature? Why are you doing it? Is it just to stay up to date? Is it to find an article for something like a journal club? Or are you conducting a literature review or perhaps even a systematic review where you're really hoping to be a lot more rigorous in your approach for a systematic review? You have to consult multiple databases, develop a very comprehensive search strategy, and it's going to be a lot more overall comprehensive. So taking a moment to assess what it is you're looking for and why just enables you to think about how far or wide you want to cast your net for information. And we're going to use this reflection time to then help direct our search in terms of choosing a database. So it's well worth spending a couple of minutes before just jumping in, thinking about why and what type of information I need to get out of consulting a database. B is for brainstorming some keywords. So you've got your well-defined and answerable clinical question. And so last week we had a look at, in order to ask a well-defined and answerable question, you need to include certain elements of the PICO framework in doing so. And so if your question related to frequency or prevalence, you needed to define the population and the outcome. And so now when it comes to searching, we're going to use very similar approach, but we don't always need to include all of the elements of the PICO framework in our search strategy. So if your question was frequency or prevalence, it's likely that you would include terms related to your population and your outcome. If your question was diagnostic test accuracy, in order to ask a well-defined and answerable clinical question, you can see that you need to include all 4 elements of the PICO framework. But when it comes time to searching, you might only include terms related to the index test and the comparator test. And the reasons for this is that, as you can see here, the names of both tests are quite unique. And so if I'm going to combine these 2 unique tests, it's likely that's really going to hone in, the database will hone in on the literature that will actually be able to address my question of interest. And if your question related to treatment effectiveness, you need to identify all 4 elements to ask an answerable question. But when searching for studies, you might only need to define the population and the intervention of interest. Just thinking about this idea of synonyms too, sometimes it might be worth to be thinking about how else people define or describe the relevant elements of your search. So for example, in the treatment effectiveness question, a Box's fracture is also known as a 5th metacarpal fracture. So if you wanted to make sure that both terms were captured, you would then make sure that both of those terms appeared in your search strategy. And so I'd just like to liken searching to the great debate in terms of, despite what your husband, wife, kids, partner, roommate say, there's actually no right or wrong way to hang a toilet roll. And I'm happy for you to quote this as evidence. But when searching for the literature, there's actually no right or wrong way to do this either. And so searching is a bit of a craft, if you like. You've got to find a way that works for you. But more importantly, it's sometimes around playing with the keywords that you've identified and combining them in different ways to make sure that the results, the articles that are retrieved by the database actually meet your needs in terms of they're relevant to your search. So if the search is too big, it might mean that you need to slim down some of the terms or find better terms to describe your problem. And if the search is too small, again, you might need to add some synonyms in to try and expand the search to make sure that the database identifies articles that are relevant to your clinical problem. Once you've identified your key search terms and you've perhaps thought of some synonyms, it's time to combine them into a search strategy. And we do this using the terms and or. And so the fancy name for these are Boolean operators. And so if we were going to combine our searches with and, what this is doing is taking search term A and then you combine it with search term B, and the database only retrieves articles that have both term A and term B present in that article. And so it's resulting in actually quite a narrow search. If you combine your search terms with or, what it's looking for in the database is any article with the search term A or the search term B, and it's returning all of those articles that have either of those search terms. And so you can imagine that the number of articles that are retrieved are actually going to be quite big because it's retrieved all of those articles related to term A and term B. So when searching, we often recommend people to start with and, because what that's going to do is really hone it in because it's looking for those two keywords appearing together. But again, it's not an exact science, and it does mean that you do have to play around a bit, just like hanging of the toilet roll. There's no right or wrong way to do it. All right, now coming back to our hypothetical scenario, what I would like you to do is, I think I've already launched the poll and it might make a bit more sense now. What do you think are the key search terms that you would use if you were going to consult a database to find evidence that answers the question we identified in week 1? So in adults who jump from an aircraft, is a parachute more effective than an empty backpack? What are the key search terms that you would approach a database to find an article that would answer this clinical question? And so people, again, I launched the poll too early, but people identified that parachute is actually a key component that's quite unique to this clinical question. And absolutely, I would include that in my search terms. So personally, I'd probably include adults. I know it's a very nondescript word, and parachute. And I'm just going to launch another poll. How would you combine this? How would you combine these two search terms? Would you use an and or would you use an or? And fantastic, the results are coming in to say that everyone would combine them using an and. And so again, we're trying to make sure that the number of articles retrieved is manageable, so we combine our search terms with an and. Moving on through the ABCD framework, when it comes time to choosing which database or resources to search for your evidence, you've really done the hard yards already in the fact that you've gone through the framework, you've gone through the assess, which is determining your scope, how big or how wide you want to do. You've also identified the best primary study design to answer your clinical question. So you're well on the way to understanding where you should start to target your search for the evidence that you're after. And so if there's lots of evidence available, it's like a common topic or a common condition or a prominent treatment, and you think there's going to be a lot of evidence available, you're likely to target your search to a systematic review. And the creme de la creme, if you like, of systematic review world is the Cochrane Library. So Cochrane reviews are highly reliable, believable, the highest source of evidence. They're very rigorous and robust. And so if there's a Cochrane review that addresses your clinical question, it's well worth believing that information because of the process that needs to be gone through for people to undertake a Cochrane review. If perhaps your question is maybe a bit more general in nature, or you're just not sure where to start, it might be best to target your search to a general medical database, something like PubMed. And so just to note, PubMed also index Cochrane reviews as well. So PubMed is often quite a good place to start in terms of looking for evidence. And Kate will give us a guide through some of the key features of PubMed and how to use it. Lastly, if your question is discipline specific, so say physiotherapy, speech pathology, occupational therapy, or social work related, perhaps it might be easier for you to search a discipline specific database, and information about these are all in your workbook. For something like physiotherapy, there's the Pedro Physiotherapy Evidence Database, so Pedro, and then speech pathology, Speech Bites. So each of these have their own discipline-specific database. So just being aware of these will help you hopefully direct where to search. For completeness, I just want you to be aware that this evidence hierarchy actually fits into a much larger evidence ecosystem. And in fact, there's other types of synthesized evidence that you can use to inform your clinical decisions. Oop, I'll come back to that. So here we have the same evidence hierarchy. In red is your primary study designs, and in blue we have our synthesized evidence. Just to, again, not to confuse the point, but just to be aware that actually there's these other sources of summarized information that you can use and may be more appropriate to answer your clinical questions. And so if we're thinking about synopses, these are similar to point of care summaries that are designed to provide you with up-to-date and quality assessed information that can be used at the point of care. And these sources can be found on some of the portals like CAP or Clinicians Knowledge Network. Thinking about summaries, so we're really thinking about clinical practice guidelines here. And so it might be from your local health district or hospital health service, or it might be national guidelines, or it might be guidelines from other countries. But the guidelines often provide your best approaches to diagnosis and treatment of healthcare conditions. And lastly, we have evidence-based practice embedded into the computer systems that we use on a daily basis. And so these would be in the form of clinical decision aids, and some that you might be familiar with are things like between the flags or drug-drug interactions or falls risk assessments, nutrition assessments. These are evidence-based tools that are already embedded in our system, and you may not even be may not even recognise, but these supports are there, are readily available for you to use on a daily basis. Just coming back to the evidence hierarchy though, this is the hierarchy you're likely to use for most of your clinical decisions, because often when you're asking a clinical decision, a clinical question, the questions that you're asking are really quite specific to what you're doing then and there for a particular patient or a group of patients. And so there might not be clinical decision aids or things like that available, but really what you're going to be referring to inform your decision making with is evidence that's coming from this evidence hierarchy. And just remembering that we're going to try and target as high up the evidence hierarchy as possible that's appropriate to the question that we're asking. So we find the highest level as possible. The other source of information that we can often use is something like the Clinical Information Access Portal, which contains several of these databases. And like I mentioned, there's an equivalent in Queensland, the Clinical Knowledge Network, and Kate will give us a bit of a guide through that in the coming slides. The last part of the framework, ABCD framework, is to document your approach. And that's either grab your handy notebook and make a few notes of how you undertook your search so that you can reproduce it for next time. The other option is to maximise the use of tools that are available in the databases. And so most of the databases offer several tools, things like that you can save your search like this. You can opt for email notifications or alerts. When new published literature becomes available, this can be emailed directly to you. So if you're working in a specific clinical area, this is often a nice way to stay up to date because you can periodically receive an email to say, hey, look, X, Y, and Z, there's 5, 10, 15 articles that meet your search criteria that are relevant specifically to you. So it's worth, if there are databases that are of interest, for example, discipline-specific databases or even a general database, something like PubMed, you can set up these alerts or run them yourself periodically, and it's a nice way to stay up to date. That's it from me, and now I'm going to hand over to Kate, who will give you a bit of a demonstration and how-to of searching. Thanks
Kate.
So
much, Zoe and Alex. Zoe, do you mind keeping control of the slides? It's just not letting me share on this end.
Sure can.
Thank you. Fantastic. Yeah, so I'm Kate. So I joined Northern New South Wales LHD at the start of this year as the conjoint allied health academic. And what I'm going to go through this afternoon is a bit of information on the help that you can get in terms of searching for evidence when you're focused on evidence-based practice. And I'm going to show you a bit of a demo of 3 databases. So that'll be CEAP, the Cochrane Library, and PubMed. So all, or hopefully most, hospital and health services and local health districts will have staff support through library services. And there's many things that the library services can help you with. That can include finding books and full text journal articles. So if you find an abstract for an article, but there's a paywall, you can contact the library and they should be able to help you out with that. They can help you with literature searches. They can provide training on using things like CEAP databases and also general searching. And they can also support with things like EndNote licenses and training. So if you're writing a paper and you need referencing and you don't want to do it the long way, then they can provide you with training and licenses for that. So every local health district and hospital and health service in Queensland will have a research office, and there's various things that the research office can assist you with as well. So one is capacity building, research education, similar to what we're doing today, research support. So they can help you if you've got an idea, a clinical question that you want to build into a research project or a quality improvement project, you can reach out to the research office in your district and they can support you with building that into a robust study. They can support with ethical and scientific review through the pathways that they have available, and also with research governance. I'm sure Alex would tell you there's many more things they do. So also most services will have conjoint academics across various areas. The conjoint academics like myself and Christina Agar in our local LHD are employed between the health service and the university. There's lots of things that we can help with too. So also things like developing clinical questions into research or quality improvement projects, establishing journal clubs, applying for research grants or applying for higher degree research if that is something that you're interested in, reviewing and submitting manuscripts, reviewing conference abstracts if you've done a study and you're wanting to submit that to a conference, connecting with academic partners, and also accessing research software like Covidence, EndNote, or NVivo. Okay, so now let's move on to our demonstrations. I didn't trust the technology enough to do this live, so I've done some screenshots for you. It's a bit risky. So with CAP, as Zoe mentioned, in Queensland, your version of CAP is Clinicians Knowledge Network, and there's loads of different online resources that can support evidence-based practice at the point of care. So on this slide, you'll see I've put some red circles around the things that would be, I think, most useful, although depending on your particular area, you may need to look at MIMS and Australian Medicine's Handbook. There are links through CAP to guidelines, to different journals, to various databases, and also to patient education resources. And then we've got evidence-based monographs and things like that on BMJ best practice, and evidence-based summaries and recommendations on UpToDate. I've popped the link in the bottom there. If it is something you haven't looked at before, it would be great to have a little play around. In terms of the evidence-based practice link on the left-hand side, if you click on that, you can see that these many things come up, including things like Cochrane Clinical Answers, which provides us with summaries of the evidence to answer our clinical questions. There's various links to the discipline-specific databases and resources that Zoe mentioned earlier, like OTCCA and Pedro and SpeechBite, and various other things. So definitely worth having a look at that. If you do want to search databases, you can click on the database section, and you can either type in some of your search terms to that top section that has the search bar, or into the article finder down below. This also links us to various databases. So if you thought, oh, well, I definitely want to look at PubMed because I've got a clinical question that I think will be answered there, you can click on that and do a search. And then you'll see in the next slide, once you've searched with a couple of terms, so if we had put in adults and parachutes like our poll, then we would get various answers coming up here. We can sort on the left-hand side by relevance or by date. So if we're only looking for studies in the last 5 years or 10 years, we could do a search like that. We could add filters. So we could say we're looking for a book or we're looking for a journal, and language filters, etc. So there's various subjects in there. You'll see at the top, there's also a section that says PICO search. So if we click to the next slide, you'll see that if you go to the PICO search, it brings up 4 boxes or 5 boxes, because there's also a T for time period. And you can then type in your PICO question. So I've popped the question about the parachutes and the empty backpacks, very risky, into there. And you can then tick that you only want to see full text papers and peer-reviewed papers. And so then if you search using that, you should get a pretty good outcome. So you'll see our paper comes up at the very top. And we can click on that full text. We'll be able to access that paper. Alternatively, if there are open access papers, you'll just be able to click on that open access. There's also an option to request the items through the library if there is a paywall there. So lots of different options available to you there. And also that's just showing the date. Okay, so then on to Cochrane Library. As I mentioned earlier, there's loads of things you can do on the Cochrane Library. So as Zoe was saying, if you're looking for a answer to a clinical question that you know there will be lots of evidence about, and you think, I'll definitely find a systematic review or randomized controlled trials or even a Cochrane review, the Cochrane Library will be a great place to go. You can do keyword searches, you can browse by different topics, you can look at the clinical answers section, which is a fantastic one to look at. And then you can also use advanced search options using things like medical subject headings or the mesh terms that we mentioned before, or you can do a PICO search here. So you'll see if you click on clinical answers, you can then go on the left-hand side, look at the different topics. So if you were looking at something in the area of neurology, you could click on that and various questions will come up there. You can go through and get a really good summary of the evidence. One of the other great things that Cochrane does is the lay language summaries. So you're then able to see and share with your patients that information that's not in medical jargon, so they're able to understand what you're talking about. So the Cochrane Library also links to Central to access randomised controlled trials. So Central is another database. And so then we'll move on to PubMed. Sorry, making your life difficult. So in PubMed, you can search for various different types of studies. We use for the intervention study, like our poll said, we're going to use our population and our intervention. So if we say adult and parachute, not adult or parachute, and do a search, then again, our paper comes up as the first one, which is great news. From there, you can either download the PDF or you can view the complete issue of the journal. Again, there's filters down the side, so there's various things that you can filter for. You could choose that you only want a full text paper, that you're only looking for a systematic review or a meta-analysis or a randomised controlled trial. So that will be particularly relevant if you have a huge search result and you think, I'm really not getting what I need. You can also sign up using your email or your ORCID ID, and that allows you to save your searches so you can go back to them in future, or to email yourself those searches. And as Zoe mentioned, you can also set up the email alerts. So if you are working in a particular area and you're wanting to find out more about the evidence in that area, you'll get regular email alerts to yourself. Okay, is this another poll, Zoe?
It is. Now that we've had a little look at the different types of databases, just putting it out to everyone, which database or resource might you use to search for our question on the effectiveness of parachutes? And I think you can click more than one. And this is another toilet roll debate in terms of there's no right or wrong, but again, thinking through that assess stage, how many articles do you think are available on the effectiveness of parachutes? Would we target a very specific database, or would we go for something more general? Would there be guidelines available on this? Give you a couple of minutes to answer. And the results are coming through, which is great. We're talking about, lots of people are suggesting that we'll consult a general medical database, which would be exactly where I would go. Firstly, I'm not sure how many articles there would be on the effectiveness of parachutes. I think there might be some ethical issues or considerations to those types of studies. So I probably wouldn't go to something like the Cochrane Cochrane Library, because I don't think there'd be enough studies to undertake a systematic review. But I'd definitely go to a general medical database, something like PubMed, one, because they index randomised controlled trials, but if there were systematic reviews, that should also come up in PubMed. The other place that I might choose to search would be something like CAP, and as Kate's just demonstrated, we can use CAP to our benefit using the PICO search strategy, and it did identify the parachute article that we're going to carry forward in the following weeks. So that's where I would go, but again, there's no right or wrong, and it's more around finding a database that you feel comfortable navigating, and that you find easy to search, and that you're finding, really more importantly, you're finding articles that are addressing your clinical questions. So just to flag that there are templates in the workbook that are available for you to work through these sort of stage thinking around your clinical problems that you identified in week 1. So it gives you a chance to think through those problems and how best to find the evidence to answer your clinical questions. That brings us to the end of session 2. And so just a very brief recap. What the information that we've gone through today. So we're always aiming to find the highest level of evidence to answer your question. And so more often than not, this comes from a systematic review of level 2 studies. For questions of treatment effectiveness, again, we're looking to change practice. So we want to make sure that we're using the highest levels of evidence. The best evidence for treatment effectiveness questions comes from systematic reviews of randomized controlled trials or randomized controlled trials themselves. We identified the key words in the PICO framework, and then we use the relevant elements or the unique elements of the PICO search to then, the PICO framework, to then develop our search strategy. And again, remembering we don't need to search for each of the terms in the PICO framework, more looking for the unusual terms that we think is going to retrieve the articles that are closest to our searching needs. Choosing the database, we can make the databases work for you. So remembering that you can use the search filters, you can filter based on time frame or year of publication, study design, article type if it's full text, and being mindful of other ways to stay up to date as an evidence-based practice professional. So you can create alerts or email alerts. You can save your search strategies to return to at a later date. So there's lots of ways that technology can help us. And if in doubt, seek help. And so Kate nicely identified 3 sources of help, and I'm sure there's more in your LHD. So research office, the library and librarians, or the conjoint academics. So you're not alone in your search or your evidence-based practice journey. So we made it through session 1, and congratulations, we just made it through session 2. Next week, when we come back together, we're going to take the 3rd step on our evidence-based practice journey, and we're going to, now that we've found the evidence, we're going to have a look at how believable and how useful the evidence is once you've found an article that's relevant and answering your clinical question. We're going to have a look at 2 approaches to critical appraisal or assessing the believability and usefulness of articles. We're going to touch on the gold standards and have a look at a pragmatic approach. And we're going to consider the main biases that are at play in the research that's available. So thanks so much for joining, and I'll hand it back over to Alex.
Thank you very much, Zoe, and thank you very much, Kate, for a very informative session. So I have unmuted everyone's microphones or made them at least accessible. We do have a little bit of time, so if anyone has any questions, you can pretty much just go for it or raise your hand or do whatever you want. So as Zoe said, we've got the next 3 sessions across the next 3 consecutive weeks. So Appraise, Apply, my personal favourite, and also Assess. Hopefully you can join us for those. Doesn't look like there's any questions. I think you've answered everyone's questions, Zoe and Kate. So look, if there are no questions, again, thank you very much for joining us. We look forward to seeing you at the next series of sessions. Enjoy the rest of your afternoon, and hopefully we'll see you next week. Goodbye, everyone.
Thank you. Bye-bye.
Thanks all.